So, do you want to start recording now or wait? Good afternoon, good morning. We'll just give it a minute while we wait for participants to join us. For everyone joining, we'll give it just another minute. Need to add some entrance music or trivia for next time, but here, I think we'll go ahead and get started. I know others are going to be joining from other calls and meetings, but I can start at least some brief introductions. So welcome. Thank you for joining us for our fourth meeting of the TEFCA Public Health Community of Practice that's being led by ONC and CDC. I'm Liz Abbott, and I have been helping to facilitate this community of practice on behalf of HLN Consulting, supporting the full initiative. And so we have other HLN, ONC, and CDC colleagues on this call today. And this is just an overview. We plan today to hear some announcements and updates from CDC and ONC related to current TEFCA developments. And then we'll spend some time hearing about HELIOS initiatives that are supporting the advancement of TEFCA data exchange. We've also set aside time for discussion and question and answers to offer that participant engagement. And then we have a couple of helpful resources to share towards the end of the meeting. So following today, we hope that you're familiar at a higher level with some of the recently completed TEFCA pilots, the status of the implementation center launch, as well as understand how HELIOS is supporting the advancement of TEFCA, such as through their query response testing initiatives. And these are just a few housekeeping reminders, same as before. And just you can see them on the screen, but please rename yourself to include your agency, your state or association. Please stay on mute when you're not speaking. And for discussions and Q&A, you can use the chat or select the reactions icon to raise your hand and we'll call on you. If you have any technical issues, please direct message Lux in the chat. And as you should have been notified when you joined, this meeting is being recorded and we will share the recording link as soon as possible following today. So we want to take a moment just briefly to recap and reflect on the June meeting. So our June meeting included a discussion on how TEFCA fits into CDC's public health data strategy, as well as the role of FHIR for TEFCA and where FHIR fits into that TEFCA roadmap. So we had great COP member engagement and received input related to relevant pilot project experience in some of your jurisdictions. You guys addressed, raised some outstanding questions that remained related to things like legal considerations and resource constraints, and shared a desire for more information and documentation on the lessons being learned through the TEFCA pilots, as well as information on providers live with TEFCA Exchange. So I'm going to just pause for a moment. I know we still have people joining to see if anyone has any reflections that you've thought about since we last met that you'd like to share or raise from that June meeting. I'll give it just a minute. Feel free to type in the chat or raise your hand if there's anything that you've been thinking about since that meeting or any questions that have come up. I see a hand, I just can't see who it is.
It's me, Bryant. I can't
Hi,
help
Bryant.
just reflecting how crazy busy this past month has been with announcements and notice of proposed rules and implementation centers and the July 1 launch of some of our demonstrations. It's just been crazy busy. So
on top of summer, yeah.
Yeah, looking forward to slowing down when I don't know, trying to think of what event in the future would shut us all down. I can't think
When
of
the
it.
world slows down again. Yeah. There's a song I love from Head in the Heart called Let's Be Still. And I went to that show right before COVID. It was kind of weird.
Oh.
But anyway, thanks for sharing. And I think, I'm prematurely raising some of this because CDC and ONC will be speaking to that in just a second here. So that's a nice segue to kick it over. Let me do that. So we have a few updates and announcements, starting with Kirsten Hageman from CDC, and then Katie Tully from ONC will be giving some announcements as well. So Kirsten, I will kick it over to you.
Yeah, hi, I'm Kirsten Hageman. I'm in OPHGST under Data Standards and Policy branch. So just wanted to kick it off with this slide that we're all familiar with. So I really just wanted to take a moment and remind everyone on the phone today that TEFCA is part of a multi-pronged strategy to advance public health data exchange and interoperability. And just all these pieces really, fit together and reinforce one another in really important ways. And then I wanted to take a moment to kick it over to Katie to speak to the highlighted box in the lower left-hand corner of your screen. So I'll have her touch on that plays a part with HDI too.
Yeah, great. So I think Kirsten teed it up nicely. So pretty much as Brian also referenced, last week, we announced a notice of proposed rulemaking for our health technology and interoperability rule number 2. And there's a lot of proposals within this proposed rule related to public health. And right now there is a competing information session that's happening, but we are going to be doing a public health focused webinar on this rule on, I'm just looking at my date, Tuesday, July 30th at 2 p.m. I'll put a link in the chat. But really just wanted to advertise it to this group because this rule does have a lot of public health components to it, and just encourage you all to track it. It does overlap with some of the stuff we'll be talking about today. Just to put a teaser if you haven't read the 1,000-page rule yet. But again, the information session that's also happening in parallel with this is recorded. So encourage you to go back, listen to that recording, and as well attend our information session on Tuesday, but the 30th, but again, a really exciting component of this overall strategy. And I'll pass back to Kirsten.
Yeah, all right, next slide. All right, so another thing that happened last week. So CDC, ASTO, NNPHI, and PHAB launched the new Implementation Center program. So this $255 million CDC-funded initiative represents a really major step forward in how we support our nation's health departments in the adoption of more flexible and advanced data sharing methods and their data modernization efforts. So the CDC for this, the lead for this program wasn't available today, so you're stuck with me. But I'll try to answer questions where I can, but we're gonna have them join at a future meeting to really do a deeper dive on the implementation centers. And then we can also drop the public announcement and then the web page link in the chat also, just in case you haven't seen it. So next slide. All right, and then for this one, this is our TEFCA pilot map. I just wanted to really take a moment to celebrate those initial TEFCA go lives on July 1st in those jurisdictions that were involved. And public health is ahead of healthcare in many ways here. And I also wanted to note that there are more TEFCA use cases coming on board with expanded use cases and new geographies. And so I really wanted to pause there and offer those states that were involved with this July 1st go live a chance to weigh in and really reflect here and just give you guys some space. So if you'd like to say anything or comment, please feel free this time.
I just need to have to thank our team behind the scenes in Washington and our partners at APHL and Epic and Legacy Health. It was a huge lift to make that deadline, and we did miss the deadline by 24 hours. We actually went live on the 2nd because the first live message that went on the 1st had some errors in it. Still it needed to be validated, but we fixed it quickly and we're live by the next day.
Awesome.
This is Ben Clecamp from Fairfax. So we met the July 1st deadline. We used the query and response. The portal has some limited data in it, but we're going to be meeting with Chris and our HIE in the next week to really kind of map out stuff. So we are, I think, planning to give some overviews of what we found next month. I believe in August. So we'll I believe that's the community of practice meeting on the 28th in August, but we'll be providing some updates then. Right now, we're still early days of just kind of figuring it out, but we did start kind of poking around on the 1st.
Congratulations. Thank you for sharing that. And we do look forward to being able to share out more detail on some of these. Does anyone else? I know we have a number of you besides Ben and Bryant that participated. Anyone else want to say anything about your experience?
Yeah, can add from Alaska kind of a very similar configuration to what Ben and Fairfax were doing in kind of logging into that kind of public health portal and submitting a query. I think there's a lot to go in kind of understanding potential information that gets returned, both the kind of the actual return of information, as public health kind of use cases still optional, we're not seeing valuable information returned that could help our public health investigations.
Thank you for that insight, Eliza. Looks like Katie typed in the chat a giant thank you to everyone. Get to that July 1st and looking forward to learning more. So lots more to cover going forward. Anybody else? Okay. If anyone thinks of anything else they'd like to say, we'll have some time at discussion and Q&A at the end as well. So, Kirsten, I can kick it back to you, or is that your final slide? Oh, go ahead, Frank.
Just one caveat on our e-case reporting use case. We heard from our partners at Epic that they had offered the enhancement, the service patch, to other Epic customers around the country early, since it was going well, rather than waiting till the next service release of Epic, which I think is next month or the month after. Do we know if any of those sites also went live on July 1?
I don't know, but I can follow up if nobody else knows.
Kirsten, that would be great if we could send out in the follow-up materials, or, bring it to the next meeting, where I think we will delve a little deeper into kind of findings and lessons and things
Yeah.
that I think CDC wants to cover in a little more depth in August.
Sounds good.
Thanks, Brian. That's good news.
And once again, Virginia beat us butt to the punch.
One day. I was looking for your reaction when Ben said we did meet the July one. So you count. It counts, Brian.
I don't mind losing to Alaska, but when I lose to Virginia, come on.
Glad you still have room for humor after such a busy month. Okay. Harrison, is that your last slide? Let's see.
I think that, I think we're gonna kick it over to Katie and HELIOS. Yeah.
Okay. Oh, well, I think Katie might have some other Did you already cover all those, Katie? You covered them. So jump into the HELIOS update. Sorry, we're doing
It's
a little tag teaming here.
No problem. Yeah, it has been a very busy month. So a lot of updates. So next slide, please. So I think this kind of builds upon the other puzzle piece that was shown earlier. But again, just a frame, just kind of how HELIOS fits in here. So as we just talked through right now, we are going through the process of bringing TEFCA live. A lot of the work that we've been doing in HELIOS to explore the use of FHIR is really intended to support a lot of these other efforts that are going on. Which again, we've always struggled to come up with a good visual, and the puzzle piece is just kind of what we've been stuck on. If anyone has any branding suggestions, you'll take it. But really, for instance, HELIOS, we just talked about the ICs and the work that's happening there as well. HELIOS is intended to really test out the use of FHIR. Forums like the ICs might then come in to where there are successes of the use of FHIR for certain use cases. They can help amplify and ensure that's implemented in a scalable way. And then we're really also looking at HELIOS, which we're going to be talking about today, through the lens of how can we combine the ideas of FHIR and TEFCA to improve public health exchange. And I know last meeting, if you all were on that, we got a deep dive from my boss, Chris Muir, on the FHIR components within the QTF. And we kind of dug into kind of from a big picture, how FHIR will function in TEFCA. Today, our goal really is to break down how we've been looking at this from kind of a smaller scale to think through. Let's start at these beginning use cases for use of FHIR to submit queries, and then think through, what benefits could this offer on TEFCA network. Next slide, please. And so before I kind of dig into that, I did just want to clarify, when we're talking about query, there's really two different types of query that will be enabled through TEFCA. And this is a little bit of a simplification, but just to make it really clear. So one, what is live on TEFCA today and what Fairfax and Alaska just talked through testing is what we call a QHIN query through TEFCA. And that's where you would submit a query and a document is returned in the form of what is a CCDA. And really, there are benefits to this use case. It can help with chart review, help review kind of a document for a relevant case, and could potentially parse into a surveillance system to pull out some of these individual pieces of information. But really the big value add, more information is helpful in any instance, but definitely, especially in jurisdictions where there is not a lot of access to data, especially from hospitals that you don't have an electronic connection to, this could maybe offer a really big net benefit. The one that we're really going to be talking through today is the use cases for querying using FHIR, which again, we're in the very early stages of this, but the idea with FHIR is that as opposed to querying to retrieve, I want to have all the information on this patient, which answers one type of question. This can be used to answer more specific questions. So I want to know, if this patient was hospitalized. If they were hospitalized, I want to know when they were admitted. So again, we'll kind of dig into, Craig's going to get into more about the specific use cases that we've been collating and exploring with the public health community. But really, at least when I think about these two different types of query, FHIR is kind of getting those quick little nuggets of information or these specific pieces of information that, again, can be maybe more easily ingested into a system. while I would say the QHIN query can get you a lot of information, which again, depending on a given use case, you know, I know CDC is also doing a lot of work with many of you to kind of help think through this, and the ICs will be helping with that as well. But definitely want to just clarify kind of these two different types of query that are enabled through TEFCA and how they're a little bit different in terms of what they return. So next slide, please. And so this all leads up to, I've teased enough, the work that we're doing through HELIOS. And I'll let Craig kind of dig into the spiel on this in a bit, but just in terms of intro, if you aren't familiar with HELIOS, it's an HL7 FHIR accelerator that's jointly supported right now by us and CDC. And right now, as I mentioned, really we're focusing on primarily the reuse of existing FHIR paradigms. So we're looking at what already exists, what is there for adoption, and how can we use that to support public health? Of course, we are finding through the process that there are things that we need to build on to existing technology to support public health. But again, really starting at what is available today and what has been, you know, already put forth through our regulations through the 21st Century Cures Act to make APIs available. So how can we start with what exists today, and how can we leverage that functionality strategically to really explore gaps in public health data exchange today? And so with that, I will, I don't know, Kirsten, if you have anything else to add from the CDC perspective. If not, I will pass it off to Craig to dig into more detail on HELIOS.
All right, so thanks, Katie. And so gap is a really important word, and we use it in a couple of different ways, I think, within HELIOS. One being there's gaps in what we can do today, what we can access today. And so HELIOS is really focused not on replicating in FHIR what you're already doing, right? But rather looking for those green fields where you're not accessing data today, or it's by phone call or fax, and making that better. So we're not looking to rip and replace all the hard work you've done over the past couple of decades, right? But really improve what you have access to. And then the other meaning of gap that we come across is really, there's a lot of standards that are out there, a lot of good work that's going on, but there are still gaps in those standards. And so part of what we're trying to do is look at specifically how public health needs to access data, and do the tools that are out there in the form of APIs, in the form of bulk data standards, do they really meet our needs? Or are there ways that we need to either fill in some of the gaps to help people understand and implement, or maybe there's gaps in the standards or even the regulations themselves where, as a community, public health needs the larger FHIR community to do some additional work. And so we're keeping an eye out for both of those things. From the very get-go, one of the things that we really recognized is that wasn't a lot of understanding broadly of FHIR in the public health community. There were several states and other jurisdictions that, you know, we're learning and getting a good handle, right? And we're seeing those same leaders talking today in Virginia and Alaska and Washington and others about the success. But there were a lot of public health agencies that just weren't at that level. And so one of the things that we really designed into HELIOS is a forum for really understanding use cases, helping public health understand what FHIR can bring to the table, and look for similarities. Because as Katie was saying, we don't want to build individualized solutions to use cases. What we want to have is a reusable, recyclable set of infrastructures that we can then apply to any number of public health use cases. And so we developed what we affectionately called at the time our Align and Optimize group, which was really looking for commonalities within public health and then identifying how to approach those with FHIR. And so we had involved a lot of different perspectives, a lot of different groups, from the HIT vendors, public health partners and associations, federal partners, and really listen to the stilts about what they needed in terms of interoperability, and then looking for standards and building blocks and ways that we could address those needs, and really do a lot of prototyping and testing and focusing in on technical pieces, the technical components that we could then use as building blocks to solve a whole bunch of different solutions. Go to the next slide, please. To date, that group and its successor, which we're now calling the HELIOS Operating Committee, new name, same great charge. We've looked at close to 20 different use cases and really sort of dug in on, what data needs to be shared, what are some of the roadblocks, what are some of the policies that do this. And we started to notice a lot of similarities. And so this really shows you the grouping of some of the use cases we looked at, and we've identified a number of different paradigms where there's common requirements, and we really want to explore how do we develop a singular infrastructure to address multiple use cases. So, there's things like bulk data. There's a number of different use cases where we need individual data, but it's on a population. And so how do we use the bulk data approach to identify patients and get that data in the hands of the people that are responsible for caring for those populations? We've identified a need for subscription, just sort of that proactive notification that something of interest has happened. It could be a hospital admission. It could be a diagnosis being added to a chart. Things like that. How do we work with our sources of data, primarily EHRs, to get those notifications so that public health knows something is going on that they need to look into? Similar to that, there's push messaging, which is about sending a bolus of data from a source system to a recipient. Think ECR, right? But it can be more than that. It could be sharing data with a neighboring state when you have one of their folks come to your attention. Or even better, sharing data back with providers. We know that, healthcare organizations are much more invested in public health interoperability when they're getting information back that helps them care for their patients. But the one that we found most commonly, and the one we're going to spend the rest of today talking about, is query and response. So how do we use those APIs that are part of the 21st Century Cures Act and the national regulations that EHRs are exposing today to get data to public health on an as-needed basis, a just-in-time basis? And this could be something as simple as demographics, but it can be reportable condition follow-up, long-term follow-up. It could be a hospitalization investigation, even newborn screening. There's a lot of different use cases that fit this pattern. And so this has become a real area of interest within our project and the community as to where we can go from here. So, and you'll see as we talk about it, particularly query and response fits well into the TEFCA paradigm, and we'll talk about that in a bit. You can go to the next slide. Not a whole lot to see here. This just shows you some of the areas that we're doing some work in. I'm sure most of you have heard us talk about aggregate data and bulk data. And you can see through our testing processes and connectathons, we've been getting a lot of good participation from key organizations and vendors. But I do want to point out on the right-hand side there, right, query and response, while it's a little bit newer, we've only been doing this for about 6 months or so formally, right? We've had a lot of interest, a lot of participation. That this is really an area of need. And so we're hoping to bring all these folks back to the table and more, including the stilts and the folks that are on this call, right, to come participate with us. You can go to the next slide. Just to give you an example, a very relatively simple one is you can, ask the question or make the statement, as a disease investigator, I want to collect supplemental information on a case to confirm, investigate, or respond to that case after receiving an initial report. And we think all of you can probably come up with a sentence similar to this, where you need data to do something that's within your job description. Now, that supplemental information can be very broad. It can be something as simple as demographics. You need to make sure that the address and the contact information you have for a patient is up to date. Maybe your ELR result had it, maybe it didn't, right? But you need it. It could be those confirmatory or additional laboratory results. It could be negative results. You want to know when someone is no longer testing for a reportable condition. Or it could be other relevant clinical information, pregnancy status, could be treatment information. What is medications have been prescribed? It can be that hospitalization. Really anything that you collect today that it's accessible through a FHIR API is certainly fair game for this sort of approach. Go to the next slide, please. Just for those of you that really haven't thought about this much, or maybe aren't quite as familiar as some of the other folks on here, we just sort of want to walk through what a process might look like at a very, very high level. So if you can go to the next one. So you've got someone that is a case investigator, a newborn screening person, whatever, they have a need for data. And so next one, right? Imagine them interacting with some FHIR-enabled application. In the FHIR world, this is typically called a client, but this is something in the system that you're working with, or it can be a standalone application that allows them to make a request for data. Next slide. That client then is going to interact with what's called an authorization server. And don't worry too much about the terms here, but this is something at that data source site, at the hospital site, that confirms that the person that's asking for the data is known, that they say they are who they say they are, and that they're authorized for data, right? We all know that security and the safety of data is paramount. And so this is all built into these FHIR workflows. So that authorization comes back, and if you can advance one, right, that now allows our end user to make that request for data. And along with it, right, there's that validation of authentication that goes to what we're now calling the resource server, that where the data actually lives. Next, please. That resource server just does a quick check with, is this really the right person? Is this a valid request for data? Hopefully they get a positive response back. And if you can go ahead, they're then able to return that data, which ultimately, one more please, gets shared with that end user in that client application or in the end system that they're working with. And now they have that data. And really, you don't even have to have the person in the loop here necessarily, at least not at the beginning. Obviously, they're the ones that, want to work with the data and need it in the end. But ultimately, you can even automate a lot of these queries, you think, right? A lab result comes in, that can be the triggering event to do some of these queries to acquire that information before a human even gets involved, so that they don't even have to look at the data and ask the question, what else do I need? It's already there. So if you can go ahead one more slide, please. So this all works. You can do a one-to-one FHIR query. So why TEFCA? Well, what TEFCA can do is really amplify those FHIR queries. All of you, no matter what your jurisdiction is, you don't have just a singular source of data. There are multiple hospitals, hospital systems, clinics, other sources of data that you rely on, that you interact with. And so rather than having to connect to individual facilities and make individual requests, you can make one ask and have it fan out to an appropriate set of data sharing partners. And you can do things like specify who you want to ask even. So there's going to be a lot of flexibility, we hope, in this TEFCA approach to simplify your lives, right? And be able to get data from multiple sources, potentially even when you don't know where that data sits. All right, one more slide, please. So this is just an example that we put together. On the right-hand side, you can see that there may be multiple stilts that are using TEFCA, and they're going to each have their own set of individual data sources that they're working with. And each one of them, like that topmost arrow, the horizontal one, they could ask one-to-one and go ask a data source on the left, do you have data that I need? But what we're hoping happens with those diagonal arrows is rather than individually directly asking a trading partner, they ask a QHIN. And this is an example that it's involved with eHealth Exchange. They've been one of our testing partners, but it can really be any QHIN that's on the TEFCA network. And so then that singular request goes to that QHIN network, and they fan it out and they pass your question along to any number of different potential data sources. And that can, as we said, be as wide or as narrow as needed to serve the purpose. That data then comes back and then gets returned to you. Which is an interesting thought. I'm sure, you know, the immediate thought that many of you had is, well, that's great, but what do I do with that data, right? How do I reconcile that data? What if there's incomplete data or conflicting data? And I don't have the answers to that, but those are exactly the right questions that are probably popping into your head. And this is what HELIOS is about, is to walk through those questions and try and answer some of them. All right, last slide, if you don't mind, which is really where do we go from here, right? What's HELIOS looking to work on over the next few months in the remainder of this year in terms of taking these FHIR queries and really getting them aligned with what TEFCA is doing? So a couple of things that you have to think about. Patient identification is always top of mind here. You want to make sure that the data that you're getting back is for the individual that you're investigating for a variety of purposes, for security, to make sure that the data that you have is accurate and complete. But I think we all know patient identification is never as simple as it sounds. Sometimes you don't find any patients. Sometimes you find multiple matching patients and you have to distinguish them. So we're talking about what that means. What are the workflows and what's going to have to be involved in getting that right patient every time? Security and authentication, we talked a little bit about that, but we want to make sure that public health operates within the bounds of the public health authority that they have, but still have robust access to data. And how do we reassure our data sources that the queries we make are within our scope of operations? That fan out that we talked about, right? We're talking about how to identify a reasonable scope of systems to query. TEFCA is envisioned as a nationwide network, but you're not going to want to send every query nationwide. And so how do we identify those potential data sources that are reasonable to ask that question of? And then finally, that example of we get data back. Now what happens? What if we get multiple data? What if it's overlapping? What if it's contradicting, right? The last thing that we want to do is provide a mountain of data for our public health staff to then have to sift through and get frustrated because, you know, the data is there multiple times or it's not there, or they don't know which version of the data to believe. So it's the other thing that we're really going to be trying to work on over the next couple of months. So I think that's our last slide. So I think we're happy to open it up for questions or thoughts, or best question yet, how do I get involved with what HELIOS is doing? We'll open it up.
Thank you so much, Craig, and Katie earlier. It's a great overview, and I think just really nice to see that practical application and walkthrough. So who has a question? Go ahead and raise your hand, type in the chat. Craig, while we wait, do you want to say anything about how to get involved for anyone who is not? Oh, you're on mute. Sorry.
Yeah, thank you. Yeah, there's a couple of ways to get involved. The easiest and probably the lowest bar is every other Thursday around the middle of the day, our query and response group has a webinar, and I'll put some of the contact information in the chat. And everyone is welcome to join these and to participate in the conversation or just listen to what's being discussed. So hopefully an hour every couple of weeks is, you know, not too much of an imposition on your already busy lives, but it's important to stay involved in what's going on and help, you know, participate in the discussions and the questions. What we also are looking for are participants for Connectathon testing. So each of those individual pieces on that last slide, there's technical parts of the workflow that we need people to check out, right? How do we do that fan out? How do we ask the questions? How do we set a reasonable scope? And so we'd love to get public health agencies bring their tools to the table, right? Or have your vendors come with you to these connectathons to actually sit down and do some proof of concept testing. The next one of those is September in association with the HL7 working group meeting in Atlanta. And so there's a real opportunity to get hands-on experience with this and learn from the systems that are doing it today, and work with them. And then finally, probably the biggest ask that we're looking for is we're looking for pilot sites, people that are interested in moving beyond proof of concept, that have trading partners that they're ready, willing, and able to work with, that we can then work with to test this out in a more realistic scenario. Initially still in test systems and sandboxes, but ultimately with a goal to going live, right? We heard, 3 states went live with TEFCA on July 1st and July 2nd, the slackers in Washington. But we want to get that. We want to get a lot more go lives like that. And so we're looking for people that are willing to come to the table, right, and work towards that sort of live implementation. So lots of levels you can get involved with.
Thank you for sharing that. And we'll look for those links in the chat, or let us know if there's anything we can share after this meeting, Craig. While others are thinking through questions for you, there was an earlier question that was addressed in the chat. Alistair had asked, this is more related to Kirsten, and if we have any sense of when the expressions of interest will be out for the implementation centers. So Kirsten, it sounds like that's being decided at a meeting happening right now, potentially,
Right
but do you have
now,
anything
yep.
you want to expand on that?
That's all I know. It's being talked about today, right, as we're speaking. So hopefully there will be more information for you all soon that we can share. Yeah, so Brian, I was going to mention this too, as Craig was talking about different ways to get more involved with HELIOS. I'm hoping to get communication and more information out in the next week or two, but CDC in partnership with CDC Foundation is looking to sponsor stilts to come to the HL7 working group meeting. It's in Atlanta in September. We're going to have a public health specific working track. So we've been working on what the schedule looks like, but there's going to be some demos and some talking sessions and really, some explanations of FHIR and how it can be used with public health. So we'll have more information out soon of how to, get interest. And if you're interested in doing that experience, it's going to be a Saturday, Sunday, ending with a reception. So really exciting that we're working on this with HL7 and other partners. So more to come on that. So hoping to have more concrete information out in the next week or two.
Kirsten, if there's something we can send out to this full group, feel free to send my way when you have it available.
Thank you.
Wonderful. What other questions do we have? I know we've got
Craig,
a little bit of a smaller group today. Go ahead.
Yeah. Craig, we missed the deadline, right? It was yesterday or day before yesterday for proposed talks for the plus part of the work group meeting, or is there still an opportunity to get some public health topics added to the agenda?
Yeah, so before I answer that, what Brian is talking about is this year or this next September working group meeting is going to be a little bit different. HL7 working group meetings are usually very hands-on sorts of things, but they're doing what's called working group meeting plus for the first day and a half, the Monday and the Tuesday morning. And it's going to be more presentation like with talks focusing in on a couple of tracks, one being AI and the other being global innovation. And so it will be a little higher level than what a lot of working group meeting is, but it's still probably going to be some very interesting topics. And so, Brian, I think there's probably still an opportunity to submit questions, although you should probably do it sooner rather than later, if we think that there are good examples of work being done by public health, either globally or in the area of AI, to align with one of those tracks. So you can reach out to Viet at HL7 or work with me and we can get stuff submitted. And if other folks have ideas on work that's happening in those two areas, AI and globally, right, happy to put you in contact with the right folks too.
Yeah, I guess it's not to accelerate our timing, but Kristen, it's kind of a cart and a horse thing. If we have a bunch of public health people approved to travel to this HL7 meeting, then we'd want to double our efforts to make sure that there is a public health track for that Monday and Tuesday with interesting talks for the public health people to attend, so they don't feel like they're outsiders.
Yeah, that's good. I think right now we just we'll have to work through that a little bit. But yeah.
All right. Well, yeah, talk to the HL7 folks. I'm sure they're well aware that it's in Atlanta, so hopefully they're motivated to make sure it's appealing to CDC.
Yeah.
Let us know if we can help with any of those connections, sharing any of the summary, Kirsten, to anyone else on your team. And I did see Leigh had put a note for you, Craig, that you responded to. But Leigh, I don't know if you want to expand on anything to share what the Southern Nevada Health District is working on related to the QHIN query project. I know you've shared a bit in the past, but is there anything else you want to elaborate on for Craig or others that's relevant for the group?
Yes, can you hear me okay?
Yep.
Yeah, we work with our state HIE to build the QHIN's query portal. So they're linked to the eHealth exchange. So we're trying to prove the concept to see if we can get all the information for our disease investigators, because Vegas is a lot of visitors, some monkeypox, legionellosis, and then there are visitors from out of state. So we are working with our HIE to build those portals. And then so since Craig mentioned the HELIO project and they have some use cases, I just wonder how can we involve, how can we collaborate? I can bring the HIE partners to the meetings as well. So we're just trying to learn, because we just have this concept. We say this is a good thing to do, but we just need some technical guidance.
Yeah, and I think we've got some good people that can help you. In particular, as I mentioned, eHealth Exchange has been a strong partner on this project from day one. And so glad to hear you're working with them. So yeah, just reach out, drop me an email, and we'll get you hooked up with what we're doing. But I think it's interesting. One thing that we hadn't really mentioned, we talked a bit about QHINs, but many of you, I'm sure, are working with your local HIEs, HINs. And so we'd love to have more of them come to the table too and understand how they're interacting with the larger QHIN networks and how that will work out in the real world when there's multiple intermediary steps. So if you are working with an HIE or something and they're interested, please share this information with them, because we'd love to get more of them to the testing table as well.
And not to put you on the spot, Jessica, but do you have anything you want to say? We do have Jessica Little representing Civitas on this community of practice, Craig, so maybe we could at least connect you guys, but I don't know if you have anything you want to speak to there, Jess.
No, you didn't put me on the spot. I was actually just chatting in, and yes, I would be happy to work with you all on engaging the HIEs. We're obviously having a ton of these conversations between Civitas and our HIE network, many of whom are the QHINs. So happy to connect, Craig.
Okay, yeah, that's great. And I know that there will be it sounds like there'll be a larger FHIR accelerator session, including HELIOS at the Civitas meeting in October.
That's correct.
Thank you. Thanks for jumping in there, Jess. All right, does anyone have any other questions? We'll drag you out. I've got a couple quick closing slides. Feel free to type in the chat if anyone comes up with anything, or we can always put you in touch with Craig or any of the other speakers following this meeting.
Yeah, and please don't be shy about reaching out. If you've got questions or just want to know what's going on or where to find the Zoom links, just drop me an email, and happy to engage that way.
Thank you. So just quickly, we've always been on these calls trying to highlight some new relevant resources, and some of you may be aware and have seen this, some may have not, but we had Alex Woodward from ASTO spoke to this coming, and it is out there publicly now. So we promised earlier that we would share with you all ASTO's FAQ that addresses questions related to TEFCA as they arise. So there's a lengthy list of questions and answers throughout this document. If you haven't seen this, I encourage you to take a look. Lux just posted that link in the chat, and a lot of these questions have come up at some of the ASTO events, as well as some that we've shared that have come up throughout our conversations through the COP. So hopefully that's a really useful resource. I do believe it'll be a living document, and they will continue to add to that and maintain this going forward, as far as I know. So I know Alex couldn't join the call today from ASTO, but they may have other updates on some other resources on a future call. And then this is just a repeat of the Implementation Center announcement. Lux dropped in the chat again that Kirsten already shared earlier. So hopefully you've all seen the news release that went out on the 11th, and very exciting to have these implementation centers finally announced. So excited to see where things move from here. And then we would appreciate if you can take a moment to complete the brief meeting survey that Lux will put in the chat, just to offer any feedback and suggestions. We are working with partners at ONC and CDC on sort of our transition plan as this work moves over to the implementation centers. So, you know, we will consider your feedback and input for our meeting in August, as well as to pass along to those implementation centers when we determine what that's going to look like in terms of a community of practice of sorts moving forward. And our next meeting will be August 22nd. So you should have these on your calendar. Please let us know if you do not have this. And so, as was mentioned today, I know CDC would like to do a deeper dive into these pilots and the use cases that Kirsten was referencing earlier. And we have a lot of other topics we still want to cover. We know there's so much to still cover. So don't hold me to it. We are considering potentially needing a longer meeting for this August session. We'll let people know as soon as possible if we do try to extend it, because we know there was interest in legal considerations, and we also want to spend some time, you know, maybe gaining input on the transition from the COP to the implementation centers. So we are still working that agenda out and what we'll actually be able to cover. But again, let me or Lux know if you haven't received the calendar invitation, and we'll keep you up to date as we determine what that meeting is going to look like. So thank you very much for spending your time with us today. We know that it's summer, it's been a crazy month, other meetings going on. So we really, really appreciate those of you that were able to present and share information, as well as speak up and just be here with us. We will see you in August, and we'll send out the recording and some of these resources after the meeting. Have a great rest of your week, everyone.